Good, happy Tuesday evening, April 27, 2021. I'm Riley King. Welcome to this Tuesday evening edition of the Riley King Newscast, right here on the Riley King Network. We have a lot of news to get to this Tuesday evening, so let's get started. First up, what will COVID testing look like as Americans return to the workplace? Let's take a listen to that video from NBC News.
Lately, it's been hard to think about the future, but thinking about the future is human nature. At Edward Jones, our 19,000 financial advisors create personalized investment strategies to help you get back to your future. Edward Jones.
Take a rapid COVID-19 test twice a week at work. That's now an option for hundreds of employees at Genpact, a digital consulting company in Texas.
I am going in to get my test.
Nichelle Boylan says it was a no-brainer to opt in. A quick swab of the nose, and within minutes, she learned the result on her phone. If it's positive, she heads home to isolate before coming into contact with coworkers. If she's negative, she goes into the office. Does it give you peace of mind?
Total peace of mind. We want to return to work, but we want to do it safely. And this helps us.
What is this doing for your employee population?
It's improving their morale. It's improving their confidence that when we say, look, we really have safety protocols that allow you to come to office.
Now, some scientists say programs like Genpact's should become standard practice so employees can safely return to work without fear that their coworkers could be asymptomatic but infectious. Harvard epidemiologist Dr. Michael Mina has been advocating for frequent rapid testing since the start of the pandemic. What do you think is the biggest misconception when it comes to rapid testing?
That rapid tests are not accurate. When used frequently, say twice a week, they will be very sensitive.
He says these rapid antigen tests will catch people who are sick before they even know they're sick, which means they stay home and don't spread the disease. Is that the most effective way to get back to what we had pre-pandemic, to reopen businesses, to reopen schools safely?
Absolutely, even if spread is ongoing in the community.
He says while Genpact's program is a good first step, businesses and even schools should adopt at-home testing. We saw it firsthand back in January.
So now you're going to swab your nose.
For this test made by Abbott, simply swab your nose, insert it into the card, and results appear in about 15 minutes.
This is definitely giving me pregnancy test flashbacks.
That's right.
To see how effective these tests can be in the real world, Mina launched a study with Citibank in February, asking 6,000 employees to test themselves at home 3 times a week. The results are uploaded to an app which tells them whether or not they can go into the office. What have you found so far?
Almost immediately, we began finding infected individuals who would have otherwise gone to work, not knowing that they were positive and transmissible that day.
The Citibank study will be completed in June. Meanwhile, Genpact is also finding asymptomatic cases. The CDC says using workplace screening to stop the spread of virus is most effective when combined with masking and social distancing. The agency recommends weekly testing, especially for businesses like hair salons and manufacturing plants, where employees are close together.
Testing plus vaccination together, I think, is the way to bring the economy back in a much faster way.
And it's very easy. I literally took this test this morning, got the results in 15 minutes from my kitchen table. Negative, yes. One line, negative. Yes. Well, Genpact's testing program is voluntary. The company says about 70% of its workers are taking part. And soon they're going to be able to do these at home twice a week. And as we talked about, you test positive, you're already at home, you isolate, you get a confirmation PCR test after that to let you know you really are positive. That way, you're not at risk of coming into the office and spreading it to everyone else before you know that you're sick.
Something like this has to happen before everybody can go back to work. I mean, there has to be some mechanism in place for sure.
So Vic, can anybody buy these tests, these home tests, anywhere?
Yeah, so the FDA has just given emergency use authorization to 2 of these at-home tests. So now they can be purchased over the counter. This one, the Binax Now test made by Abbott, they're available in Walgreens, CVS, $24 for a box of 2 tests. The box, really simple. Looks something like this. Yeah.
My question is, how accurate is it?
Well, so the key is they're most effective. These rapid antigen tests are most effective for detecting people when they are infectious. The CDC says then you got to take that second step and get the PCR test for confirmation. But the whole point is this is a screening test. So Dr. Minna is saying that had we been doing this testing from the beginning, we would have lowered our community infection rates a lot quicker.
I have 2 relatives who they thought they had allergies.
Yeah.
Right? So, and it turns out they had COVID.
Oh.
So, I mean, those are the kind of cases where you think, oh, you take a Benadryl and go to work.
Right.
What if you've already been vaccinated, though? I mean, do you still need to do this?
So you wouldn't, but here's an occasion where you might consider it. Let's say you're going to a big event, a wedding.
Yeah.
Because the science right now says even if we're vaccinated, we're not going to be sick or have severe symptoms. We could still be infectious. So if you take a test like this, you're vaccinated, but you find out you might be carrying the virus and infectious, you stay home from that big event. So that's an instance where you might see people wanting vaccinated individuals to still take the test.
Yeah, my daughter's getting married this summer, and almost, I think 95% of everybody's been vaccinated, but we're still going to require masks.
Oh, masks, exactly, yeah. And if these were more affordable, it'd be easy to have everyone test too, and you'd have another layer of security.
That's one question I was going to have. I mean, $24 for 2. I feel like you almost wouldn't take the test unless you're really feeling something.
Exactly.
But so many people are asymptomatic.
Yeah.
So, I mean, do you still recommend taking the test even if you don't have any symptoms?
Yeah, so that's the reason that, Dr. Minna and others say you need to make these things more affordable, and they need to be paid for either by the government or through your workplace so people are more apt to take them.
Sure.
$24 for 2 is still a high amount.
Right.
Yeah. It's nice to have if you have a big event.
Yeah, Vicki Wynn, thank you so much. Really appreciate it.
Okay, and
Hey, thanks for watching our YouTube channel.
There you go on that video and that report. Why a second COVID vaccine dose is necessary and need to get the second one. Let's take a listen to that video and that report.
When you buy this plant at Walmart, A&R can grow more plants so they can hire more employees. Like me.
For more on mask shots and some new summer camp rules you may have missed, in fact, let's turn to NBC News medical contributor Dr. Natalie Azar. Good morning to you.
Good morning, guys.
So you just heard Tom say that we're still waiting to hear exactly what these new outdoor mask guidelines will be. But based on what you know about the vaccines, what do you think? I mean, should we take them off, even if you're fully vaccinated?
Yikes, I know. Well, we're gonna hear what they have to say today. I think what we're gonna be hearing, so these are gonna be interim public health recommendations for fully vaccinated people. So they're not really gonna be concentrating, I think, on people who have not yet received their vaccine. And it's gonna concentrate on what we can resume and how we can resume it safely. But I think we're also gonna hear that because the CDC really can't provide specific risk levels for every activity and in every community, I think they're also going to advise that we still need to be thinking about our own personal risk, right? So, if you're a high-risk person, even though you may be allowed to do something without a mask, you may still choose to keep that mask on. And the other thing that I think is important to point out is that you can't really enforce or really know what someone's vaccination status is outside. So I think they're going to be pretty conservative when it comes to maybe concerts and sporting events. Those are the first things that come to my mind. If you go to an outdoor concert and it's going to feel like, it did pre-pandemic. We'll see what they have to say, Chanel.
Hey, Dr. Nat, I want to ask you about something else, because we just heard Tom's report there. You've got more than 100 million Americans now who've gotten at least one shot. Vaccine numbers on the decline, vaccination numbers on the decline here, down 18%. Herd immunity. We've heard so much talk about this concept of herd immunity. Folks who've already had the virus, when you factor that number in with the number of Americans who've got at least one shot, it would seem to a number of folks that we are rapidly approaching herd immunity, no?
So if you hear the number that experts are throwing out, if we do include people who've had past infection, we could be getting around 60% of people who are immune. But the caveat there, Craig, is always this. The number of people who truly have been infected is not really that easy to calculate. We've talked about the fact that, positive tests probably really underestimate, which would be a good thing, the number of people who've been infected. But we also don't know exactly how durable or efficient natural immunity is compared to the vaccine. So that's why, and we've had this conversation before, when we talk about herd immunity, we really are hanging our hats on that total vaccine number. But yes, we absolutely are including the people who have recovered from natural infection. We just don't, again, know how robust that immunity is compared to vaccine immunity.
So, Doc, the CDC releasing new guidelines this weekend for summer camps concerning masks, social distancing, vaccinations for campers and staff. They seem fairly similar to school guidance. So what's new in this? Asking for friends who can't wait to get their kids out of the house and into summer camp. Will these programs really be safe?
Yeah, so here's the thing, even last year, a lot of camps actually were able, especially like sleepaway camps. I have, a friend whose kids went to a sleepaway camp, and the way they ran that thing, boy, oh boy, it was very, very successful. And I think that experts have learned a lot from those experiences. But what I think you're going to see in these CDC guidelines, as you mentioned, Al, they do very much resemble the guidelines for schools K through 12. That is really strict adherence to mask wearing, really strict adherence to social distancing, which is another issue, of course, with kids outside and everything like that. But what's new here are vaccination recommendations. Now, of course, it's for individuals 16 and older, but that will include probably a lot of camp counselors as well as adults, the staff. And I think what's also different is that you're going to see testing strategies. So, it's very detailed. I think the take home is that the recommendations are going to be pretty strict, but I think that if they are followed, I think kids and parents can look forward to a reasonably safe and healthy camp experience this summer, Al.
Dr. Natalie, I have to ask about, actually getting the vaccine. I find it wild that 8% of those who got their first Pfizer and Moderna vaccine missed their second shot. I mean, why put yourself through the first one if you're not going to get the second one? So can you I know there is some protection after the first one, but why is it so important to get that second dose?
Right. And this is so important, Dylan, because we've talked about this, reports out, one shot is 80% effective. Why do I need to get that second shot? Some people have side effects to the first dose and are really, really scared, understandably, to get the second dose. And this is why. You basically want to get the most immune bang for your buck out of these vaccines. And in order to do that, you need that second shot. What happens when you get the second shot is that your titer of those neutralizing antibodies, those really powerful antibodies that are so important in fighting off infection, they increase about tenfold. Additionally, you're also inducing this really robust T-cell response, which is that other arm of the immune system that is so important in terms of protecting against variants. So it's not just about increasing the effectiveness from 80 to 90%, because that's very important, but it's also about durability, and it's also about protection against variants, Dylan. That's why we want you to go back for that second dose.
All right, good advice. Dr. Natalie Azar, thank you so much for joining us.
Thanks, guys.
You bet.
Okay.
Hey,
there you go on that video and that report. Very good information why it is very important to get that second dose. Not just one dose, that second dose for the Moderna and Pfizer vaccine. The Johnson & Johnson vaccine is just a one-dose vaccine, but if you get the Pfizer and Moderna, it's good to get both doses. Earlier today, Biden announces fully vaccinated people do not need masks in a small outdoor gathering. Let's take a listen to that video from MSNBC.
I really hope that this vaccine can get me one step closer to him.
To our huge wedding.
To give high fives to our patients.
To hug my students.
With every vaccine, CVS is working to bring you one step closer to a better tomorrow.
And because of the extraordinary progress we've made in fighting this virus, and the progress our scientists have made in learning about how it gets transmitted, earlier today, the CDC made an important announcement. Starting today, if you're fully vaccinated and you're outdoors, you need, and not in a big crowd, you no longer need to wear a mask. I want to be absolutely clear. If you're in a crowd, like a stadium or at a conference or a concert, you still need to wear a mask, even if you're outside. But beginning today, gathering with a group of friends in a park, going for a picnic, as long as you are vaccinated and outdoors, you can do it without a mask. The CDC is able to make this announcement because our scientists are convinced by the data that the odds of getting or giving the virus to others is very, very low if you're both been fully vaccinated and out in the open air. The CDC also helped clarify which outdoor activities are safer or less safe, depending on whether you've been vaccinated. The bottom line is clear. If you're vaccinated, you can do more things more safely, both outdoors as well as indoors. So for those who haven't gotten their vaccination yet, especially if you're younger or think you don't need it, this is another great reason to go get vaccinated. Now.
Hey, thanks for watching our YouTube channel. You should know that you can follow today's...
Okay, there you go on that video. And we are going to switch gears now and let's go into the weather. Let's take a look at the weather across the United States for this evening. In Boston, it'll be 50 degrees. New York City, it'll be 53 degrees. Washington, D.C., 65 degrees. Atlanta, Georgia, 64 degrees. Jacksonville, Florida, 63 degrees. Tampa Bay, Florida, 65 degrees. And Miami, Florida, 73 degrees. Dallas, Texas, 72 degrees. Phoenix, 56 degrees. Los Angeles, 52 degrees. Las Vegas, 59 degrees. And San Francisco, 47 degrees. That is a look at the weather across the United States for this evening. And that does it for this evening edition of the Riley King Newscast right here on the Riley King Network. Thank you for watching and have a wonderful evening. Good night and goodbye.